the first 5 minutes. I hope that we all can agree that communication is at the center of almost everything that we do, whether it is patient care or research or administration or teaching. And if we spend our time on communication, that we can do our patients, our colleagues, our people a great service with deepening the effectiveness of that communication. My name is Calvin Joe. I'm a general internist at UCSF and the VA in San Francisco. And before you start thinking he's some kind of interloper at this CHEST meeting, maybe I can also say that as a senior faculty with the Academy of Communication and Healthcare, we are delighted to undergo this integration with CHEST on deepening the importance of communication in healthcare and deepening our relationships with our patients. And with that, I'll turn it over to Susan Corbridge as part of CHEST.
Thank you. Thanks, Calvin. Well, welcome, everyone. I'm Susan Corbridge, and I have had the extreme privilege of being on the steering committee for the First 5 Minutes initiative for CHEST. And I wanted to just give a little bit of background about the project. In the fall of 2020, the CHEST Foundation launched a listening tour in 5 areas of the United States that were experiencing disproportionate incidence and mortality from COVID-19. And this was done to gain insight as well as to identify solutions about what CHEST could do to combat lung health inequities in these marginalized communities. So the areas were chosen with several criteria in mind, and some of them being, again, documented inequities in lung health, as well as in areas that had high prevalence of the predominant lung diseases such as asthma and COPD. And the CHEST Foundation reached out to community leaders, clinicians, patients, and their families, and conducted individual interviews, really looking at patient engagement, patient experience, whether negative, positive, as well as needs, and what could be done and what was being done or not to have those needs met. And most interesting, what was found and what CHEST heard as it relates to healthcare, that patients experienced a lack of access, equity, and trust. And the theme of trust really kept emerging, because also when patients were saying if lack of access was due to things like language or whether it was due to transportation, it all came back to if they didn't have a trusted relationship with their provider, they were less likely to share that information. So the other things that CHEST heard, again, is expressed by patients. These were some of the things individually that was heard from the listening tour and what some of these barriers were. Now, not only was this information, again, gained through the listening tour, but looking at the literature and looking at research that focuses on trust and how important that is, being the foundation of the patient-provider relationship. And if that is an experience, the data support that patients are less likely to adhere to their treatment regimen, as well as they are more likely to miss appointments, and they just have poor overall health and quality of life. So this then became the catalyst for this great important project, and again, for CHEST to expand beyond education just related to lung health, but to go into this area looking at trust and increasing the patient-provider relationship. So out of that was born this First 5 Minutes initiative and this great collaboration between CHEST and the American Academy of Communication, or the Academy of Communication in Healthcare, and to start this. So I'd like to show you now a video that talks about the launch of the First 5 Minutes, as well as the pilot training that we all did in San Antonio in June, which was just really a phenomenal experience.
So the pandemic really brought pulmonary and critical care to the forefront. We were the clinicians caring for these patients. So with the recognition that COVID really brought awareness to inequities in healthcare. This was the right time to first launch the listening tour, hear how we can help our patients, and now the opportunity for the first 5 minutes program to establish a relationship from the get-go with our patients that will be a positive relationship.
You know, healthcare can be so intimidating, and particularly low-income and minority communities often don't have really good healthcare. And there's generations of people who don't have good healthcare education, and that means that we've got to take a break, a pause, and listen to whether or not we're being effective in the administration of healthcare.
I feel like people are in a hurry. They can move fast, and I guess they think you can move fast too. And it's just not the case.
And so trust, I think, for me, has to be built on the consistency of a caring clinician who takes the time to listen and respond accordingly.
Trust with my clinician was really critical in my willingness to follow their instructions and to work with them.
For us as doctors, we go into a meeting with a patient thinking that we have trust, that it's understood, the patient understands that we're here to help them. But the reality is you have to earn that trust.
Any small cue that the physician gives off that is not welcoming, that seems distracted, that doesn't seem engaging, will turn that patient away from trusting that physician.
Trust is not something that's just granted. We have to earn it. And one of the nice things about the relationship-centered skills is it gives you some tools that are evidence-based and proven to help engender trust.
So that led to the idea of the first 5 minutes, because if we can establish that trust and communication with our patient in the first 5 minutes of our encounter, that could potentially lead to a future lifetime of better health for that patient and better health outcomes. What we're hoping with the first 5 minute workshop on June 18th in Bexar County is that we have the opportunity to train another 20 to 30 clinicians. And what we're hoping for is they feel very comfortable with the first 5 minute program and teaching, and then they go back to their institutions or their hospital systems, and they in turn train others on the first 5 minutes program.
The workshop went very well. I think it had a good mix of having some didactics on a PowerPoint with, at the same time, some demonstrations by the preceptors, and then also having some actual practice with some real-time feedback. I thought that was very good.
Today has been an eye-opening experience for me. Yes, I already know of several places I'll implement this in my own practice with patients in the clinic and in the hospital, but also I will bring it to medical students, residents, fellows. Maybe we should be teaching this from the beginning. Maybe we should re-look at the way we start to learn how to see a patient.
Medical training is different. You are just task-oriented, and you get your HPI done, you get your information that you need, and you know you have to fix the problem without looking at it from the patient perspective and a relationship perspective.
So for patient outcomes, it kind of makes sense that the better we communicate with our patients, the better they do stuff that we ask them to do. And it turns out that the literature on patient outcomes supports that notion that if we are clearer about our communication, if we are more empathic in our communication with our patients, that in COPD and in asthma, they're more adherent to the medications, that talking to patients who have pulmonary nodules and or early diagnoses of lung cancer, that they have decreased feelings of anxiety because they have been effectively communicated with by skilled physicians
we do different procedures in medicine. We learn, we practice, and we achieve excellence in performing those procedures. And communication is a procedure which we use the most commonly every single day in every aspect of our lives. And yet we just get the least amount of training and the least amount of practice.
Maybe this needs to go way back to where we, as experienced physicians, had learned, and say what needs to change in medical education, what needs to change in nursing education. That, I think, is where we have to go next, because I think that's how powerful this is.
Hopefully you found that very impactful, as we all did who were at the workshop. I just wanted to recognize a few individuals here in the room, as well as those not here in the room, who actually have really made this come to fruition. My colleagues on the Executive Steering Committee, Dr. Laura Cooley, Keith Mansell, and Victor Test, and Laura's here in the room, as well as from the Bexar County Steering Subcommittee, Stephanie Levin, who you saw on the video, and Dr. Jay Peters, and I don't think either one of them are in the room at this time. And then our colleagues from the Academy of Communication and Healthcare, you met Dr. Joe, as well as Dr. Stewart, who I'll be turning it over to shortly. So with that, I'll just hand it off to you.
Thank you, Susan. So, better outcomes. We touched on it a little bit in the video, and certainly preaching to the choir here that better adherence to medications comes from a trust in that these medications are going to help us. And if we have better adherence, then we are going to enjoy better outcomes. And there's a lot of data coming through that shows that there's a tremendous opportunity for us to get better. Unfortunately, we're missing a lot of opportunity to empathize with our patients. And so for me, in my experience in learning these skills that are evidence-based, one of the biggest things they've done for me is that each individual patient encounter, it reminds me I've got an opportunity for them to leave feeling better. Before they've done any inhaler, before we've prescribed any treatment, recommended a biopsy, they can leave the office that day and actually feel better. And the data supports that. What does it do for our teams? Without having some background in relationship-centered communication, I personally don't feel like I would have made it through the pandemic professionally. One of the ways this helps me is in running the team, the multidisciplinary round teams in the ICU. By structuring our daily meetings with these relationship-centered skills, it really allows people to leave things at the door that were bothering them. It empowers them to trust the team leader. And it gives them a voice to speak up during our meetings and help me, because I certainly can't remember it all. And I need that team. And without utilizing these skills and having this in my arsenal, the last 2 years would have been very, very difficult. And better outcomes for institutions. And it's not surprising that if we have an evidence-based tool to communicate with our patients in a way that engenders trust, and if we talk to each other in a way that builds relationships, we're going to have better outcomes all around. If we're enjoying ourselves at work more, we're enjoying a work family a little bit more, then that's going to translate to our patients, and we're going to see that in better patient engagement in everything that we do. And I'll turn it back over to Susan.
So I wanted to share a little personal experience from the pilot that we did in San Antonio in the workshop. But before I do that, I also want to recognize, the people that this could not have been done without, which I neglected to recognize a while ago, and I should have, the most important people, who are the fabulous and wonderful staff from CHEST. who put that slide together and, of course, so humbly left themselves off. And I do want to recognize, just how fabulous and how smart and talented the staff at CHEST is, starting with Rich Hsu, Christina Lorenza, Melissa Bustamante, David Gall, who put the wonderful video together, and several others. I think John Dietrich also was in the room earlier. And just, such a wonderful, talented staff, probably many behind the scenes too that we weren't even aware of. So thank you all so much for all your great and hard work. We're all very, very lucky to have such a talented staff at CHEST. So with that, I was asked to share a little bit about my personal experience at the pilot workshop and training that we did in San Antonio. And, I have been a nurse for 30 years. I'm a nurse practitioner and have been a nursing faculty at the University of Illinois, and I've been on faculty with our pulmonary division for over 20 years, seeing patients. And so I really thought as a nurse, and I teach communication in nursing, and as an ICU nurse for many years prior to that my communication skills and my patient rapport were good, right? And I was surprised to really learn I know I can learn something from anything I do, but I really learned, and it was so fun. And several of us in the room who were very seasoned clinicians, when we were talking at the end of the day after the pilot that we did in San Antonio at the training, we all said, wow, we're seasoned clinicians and we've really learned and we've really been able to go back and change the way that we practice with patients. So I think for me, increasing efficiency and has been key. And also sometimes going in with patients, and I would have my agenda, trying to stay on time and being respectful of the patients and not making the patients wait too long. And so I would have my agenda, and then oftentimes I would leave at the end and say, is there anything else I can do for you? And then that would open up the can of, just a lot of other things. And then I'd have to shut the door and go back in with the patient, of course. And then that puts me behind, puts the next patients waiting. So the first 5 minutes and then the training we did was actually it made me much more efficient provider, I feel, and I think I think my patients appreciate that as well. So I just wanted to share some of that too. But again, the big piece was of that many of us as very seasoned clinicians all felt that we still really learned, which was great, and it was fun.
So that ends the traditional part of the day. Normally, I think at meetings like this, I've been at meetings like this in internal medicine as well, you kind of sit and listen to the person go on for a while. And we're going to stop that right now because this is a session on communication. So what I'm going to ask, invite you to do, we're going to ask you to speak to each other. Horrors, I know, at a meeting like this, but if you wouldn't, I'd like to invite everyone to stand up and actually move to the center of the room and form two lines facing each other down the center hall here. As if you're going to speak to each other, because you will. I'm not going to force, if you feel really, really uncomfortable speaking to each other, I'm not going to force you to come in. And I encourage anybody who would like to, you might want to take a step or two closer to each other, just so you're going to actually speak to each other. And if you're in the audience and you don't want to join, I'm going to ask you to kind of speak to the person next to you. All right, so this, oh. I keep on pressing the thing here, right there. There we go. So this is called speed meeting. I'm going to give you a prompt, and one person, let's see, I'm directionally challenged right now. Is this east or west or north or south? This side? East. We'll just call this side. We'll call this side the east side, and we'll call this side the west side, okay? So the east side, I'm going to give you a prompt to speak to 1 minute to the person who's standing across from you, and then we'll switch, okay? In a moment, the room is going to get really, really loud, and I'm going to say stop, and you won't hear me. So what I'm going to ask you to do is, when you see me hold up my hand, then you raise your hand, and that is your signal to cease speaking. We're gonna practice that, okay? So, everyone, blah, 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 come on, blah, 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 blah. Come on, blah, 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 blah. Wow, you guys are good. Okay, so East Side is gonna speak first. We'll just do 2 rounds of this, okay? This is not gonna last forever. The East Side is gonna speak first, saying your name and a story that you feel comfortable sharing about your name, okay? Your name and a story you feel comfortable sharing about your name. I'll give you 1 minute. I'm gonna get my phone going here. Don't want to take 1 minute and a second. We need to take just 1 minute. Okay, you ready? Please, East Side. I need there you go. There you go. All right, so it's time for the West Side. Actually, Susan, if you would go down to the end of the line, and that way you can see whether when I raise my hand, and then everybody down there will be able to see it. Okay, West Side. 1 minute on your name and a story you wish to share about your name. Are you ready? Please. That does work a little better, doesn't it? All right, thank you. Okay, Laura, I'm going to have you take a long road down to the end of the West Side, and exactly right, slide down 1. The West Side is going to slide down 1, so now everybody is going to be standing in front of somebody new, right? Okay, take a moment to introduce yourselves with your names. Hey, Susan. Hey, Susan. There we go. All right. So I'm going to give you a different prompt. This time, West Side goes first. Okay? West Side, a food that tastes like home. We're in Nashville. We got to talk about food, right? A food that tastes like home. Are you ready? 1 minute, please. All right. East side, same prompt. A food that tastes like home to your partner. 1 minute, please. All right, we're going to do one more round. Your name? Nice to meet you. I'm going to have you go. We're going to do one more round. One more round. I'm going to pull the west side up. Please meet yourselves. Okay, thanks. One final round. East side will begin. Prompt. If you weren't in healthcare and money and skill were no object, what would you do? If you were not in healthcare and money and skill were no object, what would you do? 1 minute. Ready? Please. All right, thanks. West Side, last prompt, not in healthcare, what would you do? No skill and money, no object, please. All right, thank you. You will have an opportunity to think about what this exercise means to you. I am going to advance the slide just one. Right now, there's a little card here. It's actually a big card. This is the first 5 minutes, a list of the first 5 minutes skills. And what you've essentially done, if you look on the slide right there, is create rapport quickly in about a minute, all right? Using one of these prompts. So this is one of the features. Here comes Mel down the line to give you your very own card to take home. This is what you've just experienced is one of the sub skills of the first 5 minutes that we feature in this training. And in a moment, I'm going to ask you to to reflect on not just your experience in this exercise, but all of the things that Bert and Susan and I have spoken about overall, and just to collect some of your experiences and some of your thoughts. So if you will return, not back to your seats, because I'm going to have you get into small clutches of groups in a moment. Don't spread yourselves too far out. But spread yourself, just have a seat close by here, and then just have a seat, but don't go too far, don't go too far. I'm going to ask each of you to do for a moment, just for 1 minute, in silence, to think to yourself, what are your reactions to this presentation thus far, both the experiential pieces as well as the didactic pieces? And how do you see these activities influencing your clinical practices? Okay? We'll give you 1 minute to think about that, and then I'll give you the next step in a moment. It's a minute. All right. At this point, I'd like you to, hello. Let's try that again. Pair up with somebody. Find somebody you'd like to talk to about your thoughts, and to share your thoughts with that person for 2 minutes. Right? Find somebody, maybe you haven't met them before, maybe you already have. Please feel free to share. 2 minutes. Okay, we are at 2 minutes. Maybe I should raise my hand again. All right, the next step, there's 2 more steps that we'll be undergoing right now. The next step is to have 2 pairs coalesce with each other, so you now have a 4-some or a 5-some. Okay, so just find your little groups first. Feel free to introduce yourselves. Okay, so here's your instruction. Each of these 1, 2, 3, looks like 4 clutches of folks. Each clutch is going to get 4 minutes. And in that 4 minutes, I'd like you to come up with an ordered list of the things that you'd like to share from your experiences into the large group. All right? And the reason that it'll be an ordered list will become clear in a moment. So if you'll get out a piece of paper or your phone and start scribing down, the first thing we want to share with the large group would be this, number 2, number 3, number 4, number 5, etc. And then we'll be able to distribute some of the learnings, experiences into the large group. All right? Any questions? What questions do you have about that? Is it clear as mud?
Will there be one presenter?
There'll be 1 presenter from each group. So one person will come up and present 1 thing. Okay? So I'll give you 4 minutes for that exercise. Remember, an ordered list, right? We are at 2 minutes. If I want to make certain everybody has a chance to share their thing, so everybody get a chance to talk? All right, we're at 4 minutes. Do you guys have your ordered list? Ooh, yeah. People are already set. All right, so one person who's going to present on behalf of each group, would you mind just lining up in front of this microphone here? And for the person who's going to present on behalf of your group, Burton, is that your name?
Bert, yeah.
Burton, nice to meet you. Calvin. The one item, the first item on your list. Okay, don't present them all. just one.
Acknowledging personhood.
Acknowledging person. Thank you so much. Next, your name?
Heath Patel.
Oh yeah, right. Heath, nice to meet you again.
Again, thank you. So our reflection was just kind of more from the card than the activity that we've done today, but just in the importance of negotiating the agenda. So I think all the clinicians in the room know that that's kind of drilled into us during our coursework in terms of becoming a provider, but sometimes especially as you become more specialized, it's opening up a can of worms sometimes, so how to kind of navigate that while recognizing that they're bringing a lot to the table and individualizing your care and being okay with saying that this is not my arena of expertise, but this should definitely be addressed and kind of redirecting. So I think we always worry that we're going to get so off track if we're too open and have a hard time reeling folks in. So just that continued commitment to starting broad and being comfortable with kind of narrowing things when we need to.
Negotiating the agenda and making sure you keep the can of worms in the can. Great, thanks. Third group, yes, your name?
Rich.
Rich, nice to meet you, Rich.
Nice to meet you. So the four of us were kind of reflecting on this entire presentation that you've so wonderfully put together. And a lot of it came down to us realizing that we're treating, sometimes we need to treat the patient and not the disease. So by talking to the patient, that trust that we want is not necessarily guaranteed, like you were mentioning, Briar. But these exercises have shown us that even 1 minute is enough to build that rapport. So it can be built pretty quickly. Ultimately, all coming down to finding common ground with the patient, whether it means commenting on an article of clothing that they have, a sports team, what's on TV that they're watching. So finding that common ground does help patient care exponentially.
It's some way of establishing rapport quickly, establishing trust quickly, so that you can get to the common ground.
Yeah.
Lovely. Thank you, Rich. There was another group, right?
Okay, I'm going to build on what was just said from our group. It was brought up that you have to sometimes step out of your comfort zone to then create comfort and safety. So it kind of builds on what was just said.
Yeah, so forming trust is not a simple thing. You kind of have to push yourselves a little bit to be able to make that trust start to happen. I'm going to circle back around to Bert. Is there something else on your list that your group would like to bring up that wasn't yet mentioned?
Yeah, so one thing that came up was that some of us already do this on a regular basis. And when we omit this from our encounter because of time pressure, it diminishes ourselves as providers and our capacity to continue to do the job.
Very nice, Bert. So these skills can help engender a bidirectional relationship, is what I'm hearing. And by honoring ourselves, we can take care of more people. Heath. Yeah, do you have something else on your list, Heath? All right.
One last thing was that we were saying that as we were doing the exercise, we all kind of observed our own selves really doing more active listening. And I think that's a key part. It's part of that empathetic, shaking your head, eye contact, leaning in, and also just kind of trying to connect that bond a little bit quicker as well.
Exactly. When we feel heard, then we're more likely to engage. And sometimes we need to be intentional about reflecting what we hear.
Just one that I've been thinking about as other people have been talking is something that I struggle with, especially as a trainee, how much you share about yourself, right? And I think that's really important in forming a bond with a patient. You get taught to be very neutral, and I felt very uncomfortable previously with sharing much about myself, but I think making it bi-directional, like that exercise that we did, is really important, not just listening to their story, but if you have something, sharing it with them creates bi-directional trust that way too.
Yeah, I totally agree. Thank you, Heath. It brings the humanity into the relationship.
Maybe I'll add to that. The data in the literature suggests that if it depends on in whose service you're doing that. So self-disclosure, if it is the provider saying, well, you think you have it bad, listen to me. That kind of disclosure, not so great. But if it is in the service of deepening your relationship with the patient and therefore deepening the trust, that's where the self-disclosure can happen. And there's more and more of a movement toward disclosing our identities at the beginning of a visit, like even using pronouns. Like my pronouns are, that is self-disclosure at the beginning of a visit, and we're sort of tending more toward that. Who's next, Rich?
Did y'all have something else from your group? Rich? Did y'all want to share anything else? Is there anything else on the list?
I also have a compilation of all the entire conversation here.
And that's exactly what we want to hear. That's it, right? So thank you all for sharing with us. One of the things that the conversation kept bringing up in my mind was actually Patch Adams' quote. If you treat a disease, you'll win some, you'll lose some. If you treat a person, you'll win every time. So with that, we're going to close out today, and we just want to highlight some of the things that we're doing, working with CHEST moving forward. We've got some really exciting projects. We have the in-person, which I will highlight first as my very favorite workshop. So we have the in-person workshop, and we're planning to launch some of those in the next year, as well as we're going to support those with an e-learning module, which will focus on empathetic listening, which, by the way, is really where the money is in communication. It's the way we save time, it's the way we connect with the patient. And so we really want to build a reproducible, quick learning module that you can reinforce that skill with. And then a very exciting prospect of virtual reality. The idea of being able to practice this virtually, which would be a very safe space, and get real-time feedback from how you engage that patient in that scenario. And the lovely thing about this, although I won't say it's as good as in person, even though we haven't finished it yet, but the awesome thing about this product is it will be very flexible, and you'll be able to do it from anywhere, and it won't even require a virtual reality platform. You can do it on a PC. And so we're very excited about these products and how they will help us support communicating with our patients and each other, especially each other, as we move forward post-pandemic. That's all. Thank you all for coming.
If there are any questions or whatever, we're still here for a bit, so please feel free.